Trauma can affect any one of us at any time. Over time, as we age and see more of life, it's more likely that we'll experience some form of trauma. Trauma can involve a one-off event that's frightening or shocking, like an accident or disaster. Or it can be a prolonged or repeated situation that's difficult to escape from, like an abusive relationship. Traumatic experiences can affect us in different ways. For people living with dementia, this can be more complicated because of changes in the brain. Dementia is the name for a group of conditions that affect the brain and cause common symptoms including difficulties with memory, communication, thinking, and reasoning. Dementia also affects the ability to control emotions and behaviour. Everyone is affected differently by dementia, but it's progressive, meaning these symptoms will get worse over time. A gentleman called Bruce is going to help us understand the complex relationship between trauma and dementia. Bruce is 70 and has a diagnosis of mixed dementia. Let's go back in time to find out more about Bruce and his life. As a child, Bruce's mum and dad weren't around much. Sometimes he had to ask neighbours for food. Bruce was vulnerable and it was easy for others to take advantage of him. As a young man, Bruce joined the army and served in the Falklands War. He saw terrible things there that he's never spoken about, but they still give him nightmares. After returning from the war, Bruce married Helen. They built a happy life together with their 2 children and pet dogs. The stability and support of his family and the sense of peace he got from being outside acted as buffers, allowing Bruce to function well despite the traumatic things he had experienced. But after Helen died, Bruce missed her support and company. He started going to his local pub more to get out of the house and be around people. One night going home, Bruce was mugged and ended up in hospital. He lost his confidence and didn't go out much after that. You can see from Bruce's life that he has experienced both one-off and repeated traumatic experiences. Both types of trauma can have long-lasting effects on our physical, psychological, and social well-being. Dementia can also affect how people experience and respond to the impact of trauma. For example, people who have experienced trauma in the past can feel like they're always in danger. They can also have flashbacks or nightmares and poor sleep. Flashbacks involve re-experiencing past events vividly, as if they're happening now. For people living with dementia, flashbacks can be frequent and more intense. They can find it difficult to put these experiences into context, so it feels like traumatic situations are happening again in the here and now. Memory is a key factor in this. Like many people living with dementia, Bruce has difficulties with his short-term memory. This means he relies on older, out-of-date memories to make sense of the present. These difficulties can make the environment feel unfamiliar and unsafe, and can contribute to a sense of altered reality. Bruce experiences the present differently to those around him, which causes confusion and distress. Dementia also affects Bruce's ability to understand and manage his emotions. This means he's more sensitive to changes around him. Bruce's emotional reactions are more extreme, and it's harder to help him feel calm again. For people around him, it often looks like Bruce's behaviour changes rapidly without any warning. Because Bruce can't describe what he's experiencing, and staff aren't aware of his trauma history, they assume his behaviour is caused by dementia. People living with dementia are also more likely to experience re-traumatisation. This is when a situation makes someone feel the same way they did during a previous traumatic event. Bruce is no longer in his own home. He's surrounded by people he doesn't recognise. People don't know about his past experiences, and all the buffers that helped him to cope earlier in his life are gone. Bruce doesn't understand this, so when carers try to help him, he feels powerless, vulnerable, anxious and frightened again, like he did when the original traumas happened. All of us can work in a way that helps people living with dementia who have been impacted by trauma. We can do this by using a trauma-informed approach. Trauma-informed ways of working help to reduce the risk of people re-experiencing previous trauma or feeling frightened, trapped, or helpless in the present. After realising the prevalence of trauma and dementia and understanding the complicated relationship between them, a trauma-informed approach also involves recognising the signs and symptoms that people may have been affected by trauma. Traumatic events may or may not have been reported, but to help build a picture of someone's life, we can review their health and care records. If they're able, we can ask people living with dementia to tell us a bit about themselves and their lives. We can also speak to family members and health and social care professionals if we have permission to do this. Like a jigsaw puzzle, putting these pieces together can help us understand what has happened to you, rather than asking what's wrong with you. As people living with dementia may not be able to tell you about their experiences, recognising trauma also involves looking out for signs that a trauma reaction has been triggered and the impact this has on the person. Trauma triggers may be from the environment around the person, like sights, sounds, smells, situations or places. People and how we interact with each other can also be triggers. Some triggers may be obvious, but sometimes it's hard to tell. If we can notice them, we can then work to reduce or remove the triggers that remind people living with dementia of previous traumatic experiences. For example, Bruce can't turn off the TV when an upsetting news report comes on, but we can. It's also important that we respond in a trauma-informed way that helps people to cope with the impact of trauma. The changes Bruce has experienced since his diagnosis of dementia mean that we might need to do more to support him in this, like comforting him when he's upset, helping him to do things he enjoys, and helping him to feel safe with other people. Trauma-informed practice isn't just about what we do, it's about how we do it. We can use the 5 key principles of trauma-informed working to respond in a trauma-informed way and help to resist re-traumatisation. These 5 key principles are safety, trust, choice, collaboration, and empowerment. We can use these 5 principles to offer relationships that are the opposite to the ones where trauma happened. This helps prevent re-traumatisation. If we make these small changes to how we work and use them consistently, it can make a big difference. And this can help people living with dementia to feel safe, supported, and to live well.